بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسوله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is continuation of about mediastinal imaging, and here I will discuss the posterior mediastinum. As we see here, this is the anterior mediastinum, this is the middle mediastinum, and this is the posterior mediastinum, and it is posterior to the line about 1 centimeter points connecting the vertebral body anteriorly, and it is posterior to it. As we see here, this is the anterior mediastinum, this is the middle mediastinum, and this is the posterior mediastinum, as we see it in the blue color. The posterior mediastinum is bounded anteriorly by posterior tracheal, posterior trachea and pericardium, inferiorly by diaphragm, posteriorly by vertebral bodies, and superiorly by thoracic inlet. Contents of the posterior mediastinum contain esophagus, descending aorta, azygos and hemiazygos vein, thoracic duct, vagus, and sympathetic ganglia, also lymph node and fat. What are the masses in the posterior mediastinum? The most common masses in the posterior mediastinum is neurogenic tumor, duplication cyst, descending aneurysm, esophageal lesions, paraspinal abscess, lateral meningocele, and extramedullary hematopoiesis. Here we will see some example of the posterior mediastinal masses. As we see here, there is large homogeneous soft tissue mass near the spinal canal, consistent with a neurogenic tumor. Here, this is another MRI scan. You see this is the descending aorta, and this is the IVC, and this is the foregut duplication cyst. Another patient with foregut duplication cyst, as we see here. Here we see the ascending aorta, and this is the descending aorta with aneurysmal dilatation of the descending aorta. Here we see mass in the AB cervical spine, and that mass it is in the above the clavicle, and it is posteriorly located and proved to be neurogenic tumor. Here you see this is large hiatus hernia in the AB and lateral view. Here you see again the aorta, descending aorta is dilated, consistent with aneurysm, and here we see some cyst in the right kidney. Here we see a right paravertebral mass lesion associated with destruction of the vertebral bodies with some compromise of the spinal canal. This patient has TB with osteomyelitis and paravertebral abscess. This is a mass lesion in the right lower chest. Here you see that mass, it is not saluting with the heart, so it is located posteriorly, and the mass on the CT scan, it is paravertebral, and it is consistent with neurogenic tumor. Another neurogenic tumor, also you see mass in the VA chest. It is not saluting with the heart, so it is located posteriorly. And the mass on the CT scan, it is extended to the neural foramen, It is consistent with a neurogenic tumor. Another patient with a neurogenic tumor. This is large mass in the right paravertebral region, oval in shape with some extension to the upper abdomen, and this mass proved to be paraganglionoma. And here we see the liver is slightly hyperdense in attenuation and paravertebral mass on each side consistent with extramedullary hematopoiesis. Thank you very much for listening and hoping this will help you in daily practice. See you soon.